Is a Ms. lumbar puncture safe and necessary? Imagine trying to solve a puzzle about what's happening inside the body. A lumbar puncture, or spinal tap, is like opening a window into the brain and spinal cord. It involves inserting a small needle into the lower back to collect cerebrospinal fluid, which is the clear fluid surrounding the brain and spinal cord. In multiple sclerosis, this test helps doctors look for specific signs, like the presence of oligoclonal bands, which can support in misdiagnosis. Most people find that a lumbar puncture is safe. The procedure is performed below the level of the spinal cord, so there is no risk of damaging the spinal cord itself. Common side effects include a headache, which often worsens when sitting or standing and improves when lying down. Mild back pain or discomfort at the puncture site is also common but usually goes away quickly. Serious complications are very rare but can include bleeding, infection, or, in extremely rare cases, brainstem herniation if there is increased pressure inside the skull. To prevent these risks, healthcare providers check for signs of increased pressure and ensure blood clotting is normal before proceeding. The question of whether a lumbar puncture is necessary depends on the individual case. It is not always required for diagnosing MIS, but it can be a crucial part of the process. Doctors usually combine clinical symptoms, magnetic resonance imaging scans, and sometimes cerebrospinal fluid analysis to make an accurate diagnosis. The presence of oligoclonal bands in the cerebrospinal fluid can strongly support in misdiagnosis, especially when MRI results are unclear or when other conditions that mimic MIS need to be ruled out. When considering the procedure, most people tolerate it well. It generally causes minimal pain during and after the test. Resting afterward and avoiding strenuous activity for a day can help reduce the chance of a headache. Drinking plenty of fluids and lying down can also be helpful. Results from the cerebrospinal fluid analysis are typically available within a few days and are used alongside other clinical information to guide diagnosis. In summary, a lumbar puncture is both safe and often an important step in diagnosing multiple sclerosis. It provides valuable information that can confirm or support the diagnosis when other tests are inconclusive. As with any medical procedure, it's essential to discuss the potential benefits and risks with a healthcare professional. They can help determine whether this test is appropriate based on your individual health situation. Always seek personalized medical advice to ensure the best care.